Your friends and admirers in the first state send their best. Thanks very much for joining us today. Last year, Congress passed and President Biden signed into law the Inflation Reduction Act, as you know. It was not just the most significant climate legislation in our country's history, but also included landmark provisions to lower the high cost of many prescription drugs. I was happy to join a number of my colleagues in authoring those provisions. But our work to lower drug prices, you know, is not done. We have a real opportunity to continue tackling the cost of prescription drugs through the reforms to the pharmacy benefit manager system. And there's bipartisan interest on this committee and outside of this committee to do so. My colleague and friend, our colleague and friend, Senator Lankford, brought up, I believe, PBMs earlier while I was in another hearing. And I want to follow up on his question. What common sense PBM reforms do you think should Congress, and in particular this committee, the Finance Committee, consider that will lower the cost of prescription drugs for American families further? And will you and your team at HHS work with us to move those reforms forward during this Congress?
Senator Carper, thank you for the question. And as you know, this is an area where whatever move or change we make, we probably will find ourselves facing a complaint filed in court. There is money involved in this. But what I will tell you is that transparency is so critical to know how these middlemen are operating. So we understand where the money is going and how the drugs are getting to people who need them from the manufacturers. So I would say to you that we're going to try to do the work possible to try to increase oversight and transparency of the way PBMs operate.
Thank you, sir. I want to talk a little bit about with you about the implementation of youth mental health provisions. When I was privileged to serve as governor of Delaware, we put a public school nurse in every public school. We opened up wellness centers in just about every high school in our state. Now we're extending those, as you may recall, to our middle schools and to our elementary schools. But throughout the 8 years I was privileged to serve as governor, we focused on making sure that kids get the care that they need where they're at, in many cases in schools. Last Congress, I was co-chair, along with Senator Cassidy, of the Youth Mental Health Working Group, alongside of our colleague from Louisiana. Several of our priorities were included in the bipartisan Safer Communities Act, as you may recall, including important provisions that make it easier for schools to provide mental health services to students and to get reimbursed for those services under Medicaid, and I think maybe under the CHIP program as well. I understand that HHS is now in the process of implementing those important provisions. I like to say, find out what works and do more of that. In that spirit, could you just share with us some best practices from states that are doing a great job providing mental health services to students in school-based settings so that other states can learn from their success?
And Senator, you're right. You probably can identify a number of these programs that are really having success. What I will tell you is that we're trying to partner with those that have really gone into the schools to provide kids with early access to preventative behavioral health, mental health services. One of the programs we have is Project Aware, which really works closely with students to ensure that we're reaching them when they're manifesting certain issues regarding behavioral mental health. The other thing we're really going to try to push, and here's where we need the help of the states and governors, is to see if we can get Medicaid into the schools far more deeply and quickly, because many of these kids would qualify for Medicaid services. Why wait till a parent applies and finds out that the child is eligible to receive mental health services at a doctor's office or at a hospital, when, as you mentioned, the beauty of having a nurse at a school and maybe have behavioral health specialists at a school where you get reimbursed through Medicaid funding for having those professionals there helps us get to those children quickly.
Yeah. Last question is, federally qualified community health centers are up, as you know, for reauthorization at the end of this fiscal year. As you noted in your testimony, the President's budget includes a pathway to double the size, the program size, over 5 years and greatly expand its reach. I was pleased to see the President prioritize community health centers in his budget. As co-chair of the Senate Community Health Center Caucus with several beloved senators up and down my state that provide critical health care services to my constituents. And my question, the last question, Mr. Secretary, is can you share your thoughts on maybe the top three areas where Congress should focus when it comes to reauthorizing the federally qualified community health center program?
Well, the community health centers really delivered. They saved lives. Tens of millions of Americans got their COVID shots at community health centers. They are the centers that are oftentimes providing dental health services to Americans who otherwise don't have dental insurance. And so the 2 or 3 top priorities, expand them. There are parts of rural America that don't have good access to community health centers. Let them expand their services. Some don't provide OBGYN services because it's expensive. And at the same time, please, please pass the president's budget on community health centers because we expand the scope of community health centers and their funding so we can continue to have those great successes for so many Americans.
Good. Thank you so much. Mr. Chairman, I'm Tom Carper, and I approve that message.
Very, 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 very good. And we're glad you're on the committee. So thank you.